This video is a tour of the Trinity Community Care Clinic for our new volunteers and providers. When you come in on clinic days, the door will likely be opened by one of our staff members. When entering the clinic, the left door is for the patient waiting room and the front door is to enter into the clinic. This is the patient waiting room. Over here we have a handout table. Patients are free to grab whatever they would need. When patients come into the clinic, there will likely be a sticker sheet so patients can sign in with their name, appointment time, arrival time, and they will also have something that will say if there is any changes to their medical history and whether or not they have insurance. This is the front desk office. Our staff member, at least one person, will be up here running the front desk during clinic days. When patients do walk out of clinic and they're done with treatment, make sure they are checking out with someone up here. And also in these cabinets, there will always be files for dental clinic, UDM clinic, or hygiene clinic. These files hold our clinic appointment dates and also routing slips for that day's appointments. We also have consent forms, denture instructions, aftercare instructions for oral surgery, and anything else dental related in this cabinet and this cabinet down here. If you do happen to be running front desk as part of your volunteering for the day, then make sure to have one of these sheets out with the clinic date on it and put the patient sticker here where they signed in with up there, and also write the time in for the patient and the time out and whatever we did for that day for the appointment, and also write a next visit note on the bottom. This is exam room 1 and that is exam room 2. Exam rooms 1 and 2 are likely for hygiene. Inside exam room 1 is our panoramic image. This is the only room with the panoramic image device in it. And we also have an x-ray unit in here. Our hygiene equipment is also in here. The hygienist likely works out of rooms 1 and 2. Outside of exam room 1, there is a white cabinet. This cabinet is for hygiene and it has hygiene setups and any basic supplies that the hygienist would need. And also our x-ray sensor machine and supplies are all in here for both the doctor and for the hygienist to use. Our hygiene covers for the trays are in this cabinet. Our patient handout bags after a hygiene visit are also in here. Exam room 2 has a similar setup, except it does not have the panoramic image. This side of the rooms is for medical use in every room, and the other side is for dental use. This is also a hygiene room. Down this hallway, we have exam room 3 and 4. Exam room 3 and 4 is for doctor use. These are typically for restoration visits or oral surgery. Anything that the doctor would be working on the patients for would be done in these rooms. Doctors normally don't work in exam room 1 or 2 unless they are doing hygiene exams. This is exam room 3. We have gloves on this side. We typically leave safety glasses for the doctor and bib chain for the patient. And then on this side, we also typically should have safety goggles for the patient and like a bib chain, and then a notepad for any notes if the doctor needs to write anything down or needs assistant to write something down during the visit. We have gloves for the assistant. This cart is typically just things on hand that you would need. For example, in here, we have restoration materials, just some last minute things that you might need to grab in case it's not already in the restoration cart. Everything throughout the office is labeled. In this cabinet, we have some things that would be needed on hand, such as gauze, cotton rolls, any sort of suctions. This is all anesthetic supplies. And the irrigation system is also in here. Patient hand mirror is in here. Again, everything is labeled, so it should be easy to find for volunteers. There is also an x-ray unit in this room that can be used. The carrying lights are in rooms 3 and 4, usually plugged in. This white cabinet outside of exam room 3, between exam rooms 3 and 4, is for restoration supplies. We typically just have our regular doctor setups in here. So our doctor tray setups, basic supplies are in here. Again, everything is labeled, so basic setup supplies are in here. These are for our restoration setups for fillings. And in here we typically have extra burrs and any extra materials that we would need. Hand pieces are typically in here for doctors to use. This is inside of exam room 4, which is very similar to exam room 3. Outside of exam room 4, there is a white cabinet for surgical supplies. So anything needed for surgery would be in here. And again, everything is labeled. This is our restorations cart. Anytime there is a filling being done, we usually just bring this cart and roll it into the rooms. On top of the cart, there is UDM restorative trays. So if Detroit Mercy Dental students have multiple fillings going on at the same time, they can just grab a tray. It should have everything in there that they would need. This is also all of our burrs that we would use for fillings. And then on the bottom, we have extra restorative supplies. So anything that's not in here that has run out should be on the bottom. This also has some filling materials as well. Back here is our patient restroom. So if patients need to use the restroom, they can go in here. Back there is usually our staff restroom and volunteers restroom. And this is the back sterilization area. These two are our denture cabinets. And we typically have volunteer masks, safety goggles, and gloves up here. On clinic days, volunteers can bring them down here so that they are easy to grab. Just make sure to put them back up there after clinic is over. Over here, we have our inventory list. So if anything is running low, just be sure to record it on here. And the dental coordinator will look at that and make sure to order supplies if needed. Back here in the staff restroom is our suction unit. Suctions can be turned on by these two switches on the plug. Make sure to turn them on before clinic starts and turn them off after clinic is over. Over here in the restroom, we also have volunteer lockers. So if anyone needs to store their keys, purse, water, anything during clinic, they can store them up here. And we also have a lost and found up there. This is our sterilization area. We do have an ultrasonic and we have the blue tabs in here. Again, everything is labeled. This will be filled up with water at the beginning of clinic days. The switch to turn it on and off is over here. Just make sure that the water is not draining out. That's how you'll know if it's on or off, if you can't really tell from this. And then this is our autoclave. We typically run this at the end of clinic if we have enough time to run it. These are all of our sterilization bags back here. We can bag instruments here. You typically can lay out a tray here throughout the clinic day to put instruments on. Just make sure it's cleaned after the clinic. Back here, we can run our impressions with the stone and make the molds. And so all of our supplies to use that and equipment is over here. We can do that back here. Back here by the patient restrooms is our storage room. And in this room, we have all of our extra dental supplies. So this wall over here is all for dental. We usually store suctions, prophy cups, anything that we would need for dental procedures or hygiene procedures. There's gauze up there. Everything is typically labeled. So are the little cubbies for everything. So if anything is missing out there in any of the clinic rooms, it should be back here. If it's not here, then we're probably out of it. This storage room also has our medical supplies and pharmacy supplies, but this wall over here is the only area that dental will be using. This is our conference room. Doctors will usually do huddle in here in the morning. There is usually a sign-in sheet for volunteers to sign in and track their hours. Our laptops are here for the x-ray unit. They are labeled if we can use them for x-rays. When volunteers log in the morning into any of our computers, you can go right into Open Dental, and then this will come up for you to be able to log in. We do have a new login for volunteer assistant, so just press on that. And for the volunteer assistant login, the password is all caps TCC. So all assistants will be able to log in and be able to view the appointment book for that day and be able to access anything and write any notes if they need to or change appointments around.